Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This is Josh Sharfstein. Today, the earthquake in Syria and Turkey. I speak to Amani Kaddour, Executive Director for Syria Relief and Development, a nonprofit humanitarian organization on the ground in Syria. She is also a doctoral candidate at the Johns Hopkins Bloomberg School of Public Health. Let's listen. Amani Kaddour, thank you so much for joining me on Public Health on Call, talk about the situation in Syria and Turkey after this devastating earthquake.
Hi, Josh. Yeah, thank you for having me. I'm at a loss for words right now, so we're going to try this. But I think I first want to start just acknowledging the lives that have been lost in the last few days, the tens of thousands actually that have been killed that are still being found, our staff that are still missing and unaccounted for in northwest Syria, and certainly in Turkey, those that have lost their family members as well, including one of my staff who's still missing to this moment with his wife and child. So just really prayers to all of the people missing right now, waiting for loved ones, news of them, just with search and rescue teams just in full disarray. I think this is just, we have to take a moment to acknowledge that.
The enormous scale of this tragedy can obscure the devastation that even one death represents. Do you think people need to know to wrap their mind around what's happening right now?
Yeah, maybe I'll start with just situating what's going on right now and sort of giving a little bit of a background of where we were and how we got to this point as well. I think, this particular area, southeast Turkey, where the epicenter of the earthquake hit, which was Gaziantep and Kahramanmaraş, for those who are familiar with some of these cities. I live in Gaziantep. This is a massive humanitarian hub in the country that's responded to northwest Syria and the Syria crisis for well over a decade now. And just understanding how the Syria crisis has affected the vulnerability of people in the communities of northwest Syria in particular, which is one of the hardest hit areas due to the earthquake, in addition to southeast Turkey, obviously, where both Turkish and Syrian, refugees live and reside, and right now are still sort of grappling with this. In northwest Syria in particular, it's important to understand this is an area that is so deeply vulnerable. It's been over nearly 12 years of crisis right now. And so you have this compounded vulnerability that's just led to this point. You started with a crisis, I have to take a minute. I'm sorry.
It's okay. Of war,
essentially, of conflict. Watching the different crises within a crisis that have emerged over the years, aerial attacks to hospital facilities, weakened infrastructure due to some of these continued attacks on civilian infrastructure, hospitals, schools, marketplaces, homes. You have people in this area that have been displaced, not one, not twice, sometimes 10, 15, 20 times from different parts of the country, seeking areas just as a safe haven. It's been just trying to understand, this is a population of over 5 million people, and now the population in southeast Turkey that's also been affected. Just trying to understand and respond to this scale of needs is just unfathomable for us. I know with hospitals and clinics and water and infrastructure, more recently crippled and weakened by COVID, and followed by that, we had a massive cholera outbreak in the region that we've been responding to. So just thinking about all of these layers also of the public health consequences of this conflict, and obviously tremendous economic insecurity for the region, not only in Syria, but the surrounding countries as well. So just thinking about how all of these right now are playing out in light of this earthquake.
I mean, it goes without saying there probably hasn't been a strategic focus on shoring up the infrastructure for an earthquake. Instead, the infrastructure has been steadily eroded by conflict, disease outbreaks, COVID, and just the general disarray.
Yeah. I mean, I'm by no means, I'm certainly not a geologist, but I know that this particular region, I mean, I've lived in Turkey for many years now. It's on 3 different fault lines. It was not a matter of if, it was just a matter of when. It's been expected for the population in the country, in Syria, certainly in northern Syria, it was expected. And when I say expected, I mean within 100 years, within many decades. It just was unclear. So just that not being able to foresee some of these events, certainly infrastructure and reinforcing in northwest Syria has not been occurring. I know in Turkey, this has been the case since another tragic earthquake that hit in 1999, which was one of the largest in the country. But obviously that has not protected civilians in the country. I mean, Antakya, which is a city in southeast Turkey, is in shambles. I think over 90% of the buildings are destroyed at this point.
So we have a lack of preparation and undermining of the response systems, an inadequate healthcare system to do emergency. What is the situation now? We're talking on February 10th. How would you describe what's happening even days after this happened?
I don't have a perfect word for it, but hysteria comes to mind, I think. I think right now, this region, we've had so many first responders for this region already responding to a crisis. And now those first responders need support. They need help. They're still in disarray. They're displaced. They're disoriented. They've lost family members. They've been killed. I mean, some of the immediate challenges right now, just a few days in, is like I said, just the hysteria in terms of, first and foremost is finding people, is making sure people are alive, search and rescue. Unfortunately, this, we know the 72-hour window with search and rescue. We know that you have a few days to find people to make sure they're alive. We're past that window now. Right now, we're talking about search and recovery for people we have not seen in at least 4 or 5 days. And with search and recovery, there's a difference between Turkey and Syria, certainly, because you have international sort of support coming into Turkey, and you have search and rescue teams, trained search and rescue teams, from the global sphere coming in to respond, coming to support, and still they're inundated. I mean, there are not enough people searching in the country in Turkey. Syria is a very different story. Northwest Syria in particular, you don't have international teams getting deployed there to search and rescue. You have one particular organization, the White Helmets, that has been tasked with search and rescue. It's often called the civil defense inside this part of the population. Multiple organizations, including my own, have worked with them, given names of staff to just help and find people under the rubble. One of my own team members in Turkey was just, in Turkey, by some miracle, their building had collapsed. His wife and 2 daughters were stuck under that building for a day. And he was just not even sure they were going to survive. Eventually, they were evacuated to a hospital, and thankfully they've made it out. But this is just the story now of person after person is just wanting to know where their loved ones are. And even in the cases where we know people are deceased, and I'm sorry, there's a certain morbidity to this, and I hate to say this, right now people are in freezing cold conditions. So it's a very different situation when you're trying to find people. You have the cold that has in some way protected that aspect in a very disturbing way, where you're not necessarily able to identify bodies. We've pushed for populations from this part of the region to live with dignity. They also need to die with dignity, and we need to find people. We need to be able to bury them. We need to give their loved ones that sense of closure, because right now people don't have that.
Oh my. Tell me more about your organization.
Yeah. So SRD, or Syria Relief and Development, we've been operating on the ground in Syria for about 12 years now, since 2011, essentially since the onset of the crisis. It was actually established in direct response to the crisis in Syria and the surrounding region. So we've had an operation in place for many years now. And I would say almost 99.9% of our staff are from the region. Localization is really important for us. We've had over 2,000 staff on the ground, actually. from Turkey, from Jordan, inside the country of Syria as well, of course. And I would say our core focus from day one has been health and protection of the population. Protection of civilians is an incredibly important point, because when you think of conflict and crisis, everything falls under protection, a protection issue for people affected by crisis. For us, we've responded in terms of health. We've had hospitals, clinics, maternal and child health facilities. So, women, during times of the crisis, when women were walking for 2 days to reach a health facility or had complications, we saw a surge, threefold surge in C-sections, for example, for women unable to reach providers during the crisis. That's been something that's been really important for us in terms of making sure that people can access health services amidst this crisis. Mobile clinics have been really important to us too. There are so many parts of the population, as I mentioned earlier, that have been displaced now. Their 10th displacement, their 11th displacement, 12th displacement. You're talking about communities in hard to reach areas, in remote locations. For us, what's been important is also bringing those services. However, with the backdrop of conflict, you have a lot of this health infrastructure has collapsed. So you have to understand how to ensure there is a referral system,
right,
how to make sure there's emergency transport, there are ambulances.
So on your team, what kinds of expertise do you have?
Yeah, like I mentioned before, with over 2,000 staff on the ground, most of our team are technical experts. And what I mean by that, sort of in humanitarian speak, are doctors, are nurses, midwives, social workers, case managers for gender-based violence. As I mentioned, sexual violence has been an incredibly important part of our response, specifically for women and girls. So our focus has been to respond to the massive shortage in the humanitarian workforce that has resulted in Syria as a result of the crisis. Over 70% of the medical workforce has left the country. Oftentimes people refer to that as brain drain. Our focus has been to keep these staff supported, situated, and do various trainings and support to them to make sure they're able to serve populations with health services in the absence of other qualified personnel that have had to leave the country, unfortunately, or have been detained or tragically have died as a result of the crisis.
And now you have essentially this double whammy, because your staff and their families are in harm's way from the earthquake, but also their services are needed more than ever.
Yeah, this is unprecedented. The experiences we're going through right now are unparalleled. We've gone through multiple crises within crises within crises. It's just a domino effect. We have responded to, for example, the siege of Aleppo city. That's of different sieges in Douma and Ghouta and parts of Damascus as well. In Idlib, massive displacement. You had over 1 million people get displaced in a couple of months. Right now, our staff that have been responding for all of these years, right now, they themselves have been uprooted from their homes. Some have not made it out alive, unfortunately. We're at a loss for words, honestly, for what's going on right now.
Amini, how can people help your organization?
I would say the first is obviously support. I think, understanding that this response has been so localized. And when I say localized, I mean actors on the ground that have been responding since day one, supporting those organizations, including SRD, and many others, is absolutely imperative. They often say, as local as possible, as international as necessary, because you can't just parachute people in who don't understand the context, who don't understand the nuances. Often that has detrimental effects. What people can do first is first and foremost support for organizations that are on the ground, that are the ones that are going to be there responding, who are currently responding. That's the first thing I can say. And
you can give me a website address we can put in our show notes for your organization.
Yeah.
What other organizations might you recommend in Syria and Turkey?
I believe I mentioned it earlier, but White Helmets just doing incredible work right now with search, rescue, and recovery, unfortunately, pulling people out of the rubble. There is no equivalent in Northwest Syria for search and rescue, and it's all on the White Helmets and other organizations. We've always collaborated with them. We've always worked with them because, though we respond on the medical side, for example, and we've already deployed, 25 of our ambulances to different regions that are where people are being pulled out who are still alive and need critical critical medical care immediately, we need to support search and rescue teams as well that are so spread thin right now.
What can the international community do?
If we're going to focus the conversation on who can help, if we're talking at the international level, we need to raise this to an L3 level emergency. I know that's a little bit technical for those who aren't in the aid sector, but we need to declare this an emergency. Oftentimes in public health, it's obviously called a public health emergency of international concern. That's what we're dealing with right now. Unless it is amplified, we're not able to respond in the same way. We're not able to deploy competent teams who can support these local responders that are on the ground. That's
and who
absolutely
does that
imperative.
declaration?
The UN, the United Nations. Yes. Certainly. We work hand in hand with the UN. We partner with the WHO and UNFPA and so many of the other incredible, obviously, agencies. But, these declarations are made at such a high level. Obviously, organizations that are on the ground can push and advocate for that. I'm an individual that's briefed the UN Security Council twice already. A lot of these decisions can be politicized. It's really important to maintain and prioritize humanitarian response first and foremost before anything else, and certainly the political aspects of this response.
So we want to see action by the UN. People can make contributions to frontline organizations.
I have another one also, just in terms of just response, and I'll stop there because I know there's so many others.
We'll take it.
But certainly, with major governments that have responded, certainly with government of Syria. And on the Turkish side, the same needs to be done for the population of Northwest Syria. I do not work for the U.S. government, but there's something called the Presidential Drawdown Authority. This is oftentimes where the Department of Defense, or DoD, can also come in and deploy support within hours. We need that kind of support right now, because every single minute and hour that we wait, there are more lives that are lost right now.
Thank you for your time explaining this. As I was saying, it's our thoughts, it's our hearts, it's our prayers are with you, the people in Syria and Turkey. Thanks for all you have done and for, all that you and your team will be doing in this incredible moment of crisis.
Well, thank you so much. Thank you for having me. And again, just, praying for the victims, for the survivors, and obviously for those who have already lost loved ones.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.